next speaker, Dr. Palani Sami.
He's not there.
Whom have you called? किसको बुलाएं?
Same.
Palani Sami. I just said his
Right.
Good evening all. The study is on OCT biomarkers in diabetic macular edema and their role in prognosticating the visual outcome. So there is no financial interest in this presentation. We all know that diabetes mellitus is a major health problem with the prevalence rate of diabetic retinopathy 34% and macular edema is 6.81%. So this macular edema is assessed using spectral domain OCT, which is a non-invasive technique to assess the quantitative and qualitative parameters. So the main objectives of this study is to study the OCT biomarkers in diabetic macular edema and their changes after different intravitreal injections and to correlate these changes with the visual outcome. So it is a prospective cohort study and the inclusion criteria are moderate to severe NPDR diabetic retinopathy patients and early PDR patients and the age group of 35 to 75 years and HbA1c of less than 8 gram percentage and OCT signal strength of more than 6. And the exclusion criteria are type 1 diabetes patients and hazy media patients, then past history of any vitrectomy and panretinal photocoagulation and intravitreal injections. Then poor visual acuity and high myopia patients are excluded in this study. So the patients fulfilling inclusion and exclusion criteria are subjected to baseline evaluations of visual acuity, IOP, and a detailed slit lamp examination of anterior segment and a dilated fundoscopy. Then spectral domain OCT images have been taken. Though the intravitreal injection has been given, after that 1 month, the same baseline evaluations are repeated, including the OCT images. Then these parameters that are taken before and after the injection are subjected to statistical analysis. The imaging modality being all the images are obtained using Cirrus HD OCT and fovea centralized images, both HD raster and enhanced depth imaging images also taken, and the 7 OCT parameters are included in this study. First is central macular thickness, in which it is provided by the machine automated measurement, and the subfoveal choroidal thickness is measured in a HD raster scan just beneath the fovea, a hyperreflectivity line of RPE to the sclerochoroidal junction line. Then the height of subretinal fluids are measured using inbuilt caliper tool just beneath the fovea, but perpendicular to the RPE layers. And the height of intraretinal cyst are measured using the caliper tool. The largest cyst that is present beneath the fovea are included. Then hyperreflective foci are counted manually within the radius of 1500 microns in fovea centered scans, and the ellipsoid zone integrity are recorded within 1500 microns radius. It is an intact or disrupted ones. Then disorganization of inner retinal layers. This is assessed within central 1000 microns with the fovea center. Here disorganization of inner retinal layers are present only if there is any if we are unable to demarcate the retinal layers in the OCT scans. Then the results are being total 42 eyes are included and mean age of 55, then 29 eyes received ranibizumab and 13 eyes received triamcinolone. Then 13 patients are hypertensive and 2 were already known CKD patients. So in using the in quantitative parameters from baseline to 1 month, CMT and height of SRF and height of intraretinal cyst and number of hyperrefractive foci showed significant changes. Then in qualitative parameters, ellipsoid zone doesn't show any significant change, and the disorganization of inner retinal layer showed significant change after intravitreal injection. Then on correlating these parameters with the visual outcome showed significance for central macular thickness, subfoveal choroidal thickness, and height of subretinal fluid and height of intraretinal cyst. So from this, only these 4 parameters are concluding for the visual prognosis. These parameters, if present before giving the injection, if the patient has any hyperreflective foci or any disorganization of inner retinal layers and ellipsoid zone integrity, is a poor prognostic factor. Even after injection also, those patients shows poor prognosis of the visual outcome only. So in this study, apart from the previous studies, they have taken one maximum of 6 parameters. They have included 7 parameters, including the subfoveal choroidal thickness also, and It is a short-term study of 1 month period, but previous studies are maximum they have done of at least 3 months or at least up to 12 months. I have given in this study I have done only one injection. After one injection, in the treatment naive patients I have included. The previously they have included the previous treatment patients also. Then I'm concluding that the OCT biomarkers previously we will be using to see the therapeutic response only, but we can use the prognostic response also. Then presence of hyperreflective foci at the baseline is an indication for steroid injections. Thank you.
Okay, I have one question. How have you correlated with vision improvement in 1 month? Just can you come back to that?
Huh,
Because
ma'am.
your aim was to correlate with the vision improvement.
Yes, ma'am.
So I couldn't see the correlation.
They are.
No, was there a, just you can speak out. What was the correlation?
Ma'am, visual acuity is we recorded in Snell's, ma'am. It's been converted into logmar values.
So
Then, ma'am, the central macular thickness, these parameters correlation coefficient
the
has been
change.
taken.
You have to tell us a change. How many of them improved? This you're saying that this was a BCVA in total eyes, but
Yes, ma'am.
what was the change from after giving the injection? How many improved with how many lines? Otherwise, how will we know that the BCVA has increased? Because you took all patients who were more than 5/60 vision,
Yes,
right?
ma'am. Yes, ma'am.
Then you say that BCVA in total eyes, you have to see the change, na? That doesn't show in your this thing.
Ma'am, here I have taken the changes in the parameters now.
But the
So
change in
these
vision
changes
also-
of mean with the changes of vision mean also, ma'am, has been correlated with the each parameters, each one of the parameters, ma'am. I haven't taken
Or
assess
maybe
in
you
a
have not
specific
shown it here, but you
patient.
must have done it. All right. Thank you.
Yes, thank you.